Assume opening the chest cavity during chest surgery, but you don't know which instrument to pick first. One wrong choice can slow the entire procedure. In this lecture-based video, I will show you the essential thoracic basic surgery instrument. Every surgical student must recognize. If you are medical student, surgical trainee studying thoracic surgery, these instruments are mandatory to know. Stay till the end, because I will show you a simple trick to remember all thoracic instruments for exam. Let's break down them one by one. Alright. First thoracic surgery basic instrument is rib spreader, also known as retractor, used to spread the ribs to gain access in the thoracic cavity, allowing for easier performance of prolonged surgeries. It's available in different sizes, and some retractors have interchangeable valve and blade attachments, enabling adjustment of blade sizes according to the patient, infant, child, adult, or deep cavity. What is the pro tip for remembering? If you are learning thoracic instrument, focus on just three things: jaw, shape, and locking mechanism. That's the fastest way to recognize them. Alright. Next instrument is Allison lung retractor. This is a specialized thoracic instrument used to hold, retract, and lift the lung. They create clear and stable field during long and deep surgery. These smooth edges prevent injury to delicate tissue like lung. Next thoracic surgery basic instrument is Doyne rib periosteum elevator. It's specialized design to elevate, scrape, and separate the periosteum from the surface of ribs. In thoracic surgery, the right instrument at the right moment saves time and prevents tissue damage, so knowing them by shape is just as important as knowing their names. Alright, now this is Davidson scapular retractor, used to lift the scapula to expose ribs and chest wall during posterior lateral thoracotomy. Now, this is double action bone nibbler, commonly used for nibble the bone. If there is a rib fracture or irregular sharp rib edges, it's used to nibble and smooth out the bone. Now, this is a rib cutter, also known as rib shear, used to precisely cut the rib. It's utilized to create a window if required in the thoracic cavity by cutting the rib. Most beginners confuse thoracic instruments, but once you notice the curve and tip design, identifying them becomes much easier. Alright, now we have belly rib approximator, typically used to during the closure of the thoracotomies. This instrument designed to bring, hold, and stabilize separated ribs together. Its claw heads allow securely grips the rib. Next instrument is periosteal notch elevator. Its specialized design provides creating clear surgical access to the rib, used for scrape or separate the soft tissue or periosteum from the rib. Alright, now we have periosteum elevator. Its uses is similar to the periosteal notch elevator, but the difference lies in their shapes. We choose one over the other based on the surgical site and rib shear. Now, next instrument is dual forceps, also known as lung holding forceps, commonly used to holding and retracting the lung. It provides secure and atraumatic grip. Alright, this is last thoracic surgery basic instrument, a tube dilator. We use this instrument to dilate the tube. This concludes today's lecture on basic instruments used in thoracic surgery. I hope this session has been informative and has enhanced your understanding of the topic. If you have any question or require further clarification, please feel free to ask in the comment section. The next lecture covering general instrument in thoracic surgery will be uploaded soon. Stay connected with us. Thanks for watching.